meeting to order. Excuse me, under previous business. Did I get a motion to approve the previous meeting minutes?
So moved.
Second. Second by Sean, in favor?
Aye.
Opposed? Number 1, local law number S for 2018, a local law to require hospitals to post policies on reproductive health care, non-discrimination charity care, and admissions in Albany County. I understand it's being tabled, Mr. Powell?
Correct.
Okay. Number 2, resolution number 494 for 2018, a public hearing of proposed local law number S for 2018, also being tabled. Number 3, local law number E for 2019, a local law of the County of Albany, New York, restricting the sale of flavored tobacco products. We have both the sponsor, Mr. Miller, here, and also Commissioner Whalen, so thank you for your thoughts on this too. So any questions for either Commissioner Whalen or our sponsor at this time?
I do.
Go ahead.
Paul, have you gotten anywhere with the marijuana exclusion? That's
Yeah, I've got indication back that it's not, the wording that was cited in there relates to tobacco cessation products, it's not for marijuana. The intent was never to carve out anything for marijuana. My intent was that we didn't put anything in relating to marijuana because it wasn't legal, but if, you know, if it became legal, I don't want flavored marijuana either, so that was not something that was put in there. The accessories were to make sure that, you know, that they could still have tobacco cessation products which are licensed by the FDA. That's what, you know, that's what the wording is in there.
Now, you know, we've heard from a lot of people whose objection to this bill has nothing to do with youth cessation. I think everybody supports youth cessation and prevention, you know, for smoking and for tobacco usage, rather, it's a better way to put it. But there's been a lot of opposition as it relates to how this affects willing adults for all manner of products beyond just the vaping products that seem to be sort of the focus of this, you know. And I know at the law committee, you know, Paul Bergdorf came in with a bunch of stuff that was examples,
Yeah.
but that's all true. And having spoken to a lot of, what's the word, you know, age-matured people who enjoy the pipe or who enjoy the cigar at the bar mitzvah or whatever it is, a lot of people find this objectionable that, you know, mature adults are being forced to give up any of their hobby pleasures, so to speak, because we're focused on a product that might be used by youth, and in fact is often used by youth. Have you given any consideration to tempering this bill to give people their individual rights back who are adults and consenting?
I guess my analogy this time, I've raised it at the law committee also, was that, you know, when you go into the drugstore to buy medicine, either over the counter or the prescription medicine for adults, it's not flavored. So, I mean, these things, that the flavors that you're talking about, whether it's hookahs or cigars, and there are a lot of cigars, I mean, you're talking about high-end cigars, but there's a lot of cigars that are being targeted to low-income people with flavors in them, okay, already. So that's the other issue with these flavors, and they're getting into the hands of kids. And it's not just adults that you're talking about that are using these products, so that's why we left it the way it is.
Well, I mean, I'm glad you mentioned the hookahs, because I think we also really run the risk of trampling on cultural, you know, rights and customs here. And I think, you know, we've heard from some people in that community who have felt that this is overreaching for government, and I believe it's overreaching. I mean, I'd like to make my position clear on the record that I'm very much against tobacco usage in general from my personal perspective, but I don't believe that I have a right to tell somebody else that's a consenting adult. However, with children in high school, children in middle school, I am well aware that we have a problem with that. I've said all along that I think the way to combat this is much, much stricter ramifications and penalties for people who give or sell not just tobacco products, but alcohol, you know, opioids, anything to minors. That they be penalties with real teeth, jail time, fines, etc. That keeping products out of the hands of youth comes down to the accountability for people, and if people break that compact with society, that they be punished. So I'm against restricting adults from using products that they may or may not choose to partake in, while I agree with you on the youth cessation point of view.
You know, I guess we can refer this question to council. My understanding is that we cannot enact laws that are criminal laws at the county level on it.
Well, I understand that.
So that would have to be at the state level, so this is basically all we can do to stem this flow. And, there are costs involved with the fact that adults are smoking. I mean, there's health costs. The county has substantial Medicaid costs that we're absorbing because of, people smoking. So there is a benefit to the county to reduce smoking, whether it's adults or youth, so.
Well, but you do bring up a good point, which is jurisdictionally, this isn't really what we should be doing. I mean, this is a state level policy because it could be addressed on a wider
That's
and a
not what I
broader
said.
range.
I said that we can't do criminal.
No, I understand that, but.
I didn't say that we shouldn't do this, and there have been other counties that have done this. It's been done in Dutchess County, Cayuga, Dutchess, Ulster County, and I believe also Rockland County, the village of Dolesville, and Newburgh.
I don't believe that this bill exists specifically, what you're saying, but there may be some parallels. But it is a state, in my opinion, it's much more appropriate in a state venue, and where they could enact criminal penalties, or they could take measures that preserve individuals' rights, as well as, put teeth to enforcing the laws we already have, which are that you can't sell or provide tobacco products to youths under the age of 21. I mean, we could argue whether you're an adult 21 or 20 or 19, but the law is 21, and that already exists. So what's interesting here is we're not really enforcing the laws that already exist while we're making new ones. I really think this should be done at a state level.
I think Dr. Whalen could attest to that they do enforce move that law.
No,
21.
they are at shops, but I'm talking about the individual who are doing this that aren't under the control of retail licenses. And that's where the crime is being committed. Okay, let's be honest, it's a crime, right? But we're not getting to the bottom of that. So,
we are enforcing the law we have, and that's what I want to make sure.
are we though?
That's
I mean, are we making arrests for people who are giving
We don't
vaping
make
products?
arrests. It's not.
Okay,
Our
so,
law says that they can't sell to under 21. It doesn't say.
I understand that. What I'm saying is individuals who are purporting this problem. That's why I make the point that at the state level, they would have the ability to bring forth legislation that didn't help one group of people while trampling the rights of others. And while we're talking about money, there's certainly a health benefit to people using fewer tobacco products. Nobody would ever disagree with that. Whether it's attributable to a savings in Albany County is very difficult to quantify. Why? Because those savings could be decades later, and that person may or may not live here, or people may move here from other places that don't have the same laws. We can't quantify that. What we could do, if we had the right data, is quantify what sales tax revenue we lose and what employment we lose when we drive some of these businesses that rely heavily on flavored tobacco of any kind, when we drive them out of business with a sweeping legislation like this. That's why I am against its broad scope, because of the impact upon the community, that to help one set of the community hurts another. And I don't think we should do that. I think we should be trying to find legislation that works for the betterment of everybody. So for that, I object, and I encourage you again to try to limit the scope of this to just make it narrower, maybe.
I told you before the meeting when you asked me about the sales tax, the controller's office has no records available from the state or from the county level to split the sales tax to tell you how much relates to tobacco or vaping products, so we don't have that information.
Right, but to put a blindfold on doesn't mean it's not happening.
No, I'm just saying.
It's still happening.
But it's the same argument you're giving on the other side, where you're saying you can't quantify Medicaid savings, you can't quantify the loss of revenue on sales tax either. So.
But it's not the same thing, because it's very difficult, and I'm sure Commissioner Williams could expound on this for hours, but health is a much more complicated field. Public health, it's very difficult to, you can't necessarily put a name on public health. It's a much broader concept, whereas sales tax revenue is very specific. If I have a business and I sell $300,000 in sales, and it's 8% sales tax, that's $24,000. It's quantifiable immediately. You would have to audit to find that answer, but it is possible to understand that answer.
Well, I think, if you look at
The controller just doesn't have it.
If you look at our budget, the
that is
amount
unquantifiable.
we're paying for Medicaid is quantifiable, and it's very substantial. The county executives made an issue of that numerous times, that we're paying out of our budget, and I don't have the exact percentage, but it's pretty high of our budget is going to mandated things including Medicaid, which is a substantial portion of our budget. So it is quantifiable. It may not be quantifiable what portion you're going to save, but the number's out there as much as the sales tax money is out.
Well, the true statistic there would have to be broken down. You have to say, okay, what tobacco-related illnesses are being paid for Medicare in a population that could have been affected, that, it's just more complicated, is what I'm saying. But sales tax is pretty straightforward, as most financial numbers are. You could determine that. You could also determine employment numbers and how many businesses might be lost and so on and so forth. So those numbers could be produced to determine what the impact on the local economy is. So in short, I encourage you to narrow the scope of this law that helps us work to help kids, but still retains the rights of consenting adults.
Thanks, Mr. Drake. So we
Thank
did
you.
ask Commissioner Whalen to come tonight. We did ask you to come, but would you like to share any thoughts on this before
Sure,
we move forward?
and as you are aware, we were asked to discuss this among the Board of Health, which was brought up at the June 6th meeting, and at that time, we discussed the health effects and what we know about flavored tobacco and in terms of electronic cigarettes. The question that originally had been posed to us was, if there was a ban on flavored cigarettes, would there be a health impact to the current smokers in Albany County? And our answer was no. The legislation as it is proposed does not ban electronic nicotine delivery systems or e-cigarettes. It just bans flavored products. The board did find, and I think there is consistent and broad public health evidence to support that there is a public health crisis among youth use of electronic cigarettes, and we know that is driven particularly by flavored products. We know that this is the reason that kids are initiating in incredibly large numbers, and I have brought the latest snapshot from the New York State Department of Health. An additional concern when we talk about this is that research is showing that kids that start on this stuff have a very high percentage of going on to smoking regular cigarettes. So I think looking at the history of how this product came about is important. We know that in 2009, there was legislation passed for the FDA to take over tobacco. But for some reason, electronic cigarettes were not included on this, nor flavored products. Between 2011 and 2014, the marketing flooded the United States, and in particular, flavors that would attract youth encouraged youth use. We saw unprecedented rises in the initiation of youth use, and what we're seeing now, for the first time since 2000, is an uptick in the amount of kids that are smoking. This is catastrophic, and this is a serious public health crisis, and this is why I think that this legislation is important. In terms of the data that we have at this point, and when I talk about data, we look at meta-analyses. Because you can point out, a study said this, a study said this, a study said this, and we could all be here arguing that all night. When you look at meta-analysis, you look at large bodies of information and how they're put together and what conclusions they draw. And no matter what you look at, we don't have enough evidence to support. What we are seeing is that electronic nicotine delivery systems, or e-cigarettes, are better than placebos and do have some merit to help people who want to transition from smoking. However, we also see that unlike other FDA-approved smoking cessation aids, of which this is not, they are not FDA-approved, there is no off-ramp. So the statistics that show an 18% quit rate, 90% of those people are still using e-cigarettes in a year. So it's a transition. It's a transition. It is not necessarily something that is going to help people quit nicotine. In terms of the chemicals, yes, we know that it's likely that the chemicals that are in electronic cigarettes are less harmful or less plentiful than they are in traditional tobacco cigarettes. But we do not know that they are harmless. The flavors by themselves, and the research is at its infancy, have been shown to be respiratory irritants. A lot of them went into these products because they had been approved by the FDA for ingestion. So food coloring or food flavoring. But ingestion via eating isn't the same thing as inhalation. So we're starting to see evidence that these can cause respiratory tract irritations and can cause damage in cardiovascular cells. This research is early. I cannot categorically state at this time what the adverse health effects are, but I can state, based on what I've seen, it's not harmless. It's not harmless. And we are looking at an explosion of youth use. I do stick to the evidence, but I will say anecdotally, I have 3 children in high school, and these things are everywhere. They are in every backpack. Every kid is utilizing these, and this is just simply not something that was present 10 years ago. So it is a public health concern. I think we have to look at, how we market and how we monitor these products very carefully. San Francisco today banned all electronic cigarettes. That happened today. It is definitely the FDA, and what they said is we're not going to go forward with these until the FDA approves them. The FDA has shortened their timelines on manufacturers to say, what can you do to show us this is a safe product? And most of those, we'll see a lot of that between 2021 and 2022. But in the meantime, the statistics that we see in terms of youth use and youth smoking really, to me, represents a public health emergency that we need to step in and control at any way possible. I think it's difficult to control this on a larger level because when you talk about bigger levels, you talk about bigger business and bigger concerns. So I think, from my perspective, for Albany County to move forward with legislation like this is a great example for others that are having. We know that there are similar bills in New York City. This has been discussed on a national level by the FDA. It is being discussed in New York. There are a lot of people that are talking about this. But we know industry as well. It has a lot of concerns, and that balance is difficult. But from a health perspective, the Board of Health entirely endorses this legislation.
Thank you, Commissioner. Any questions for the Commissioner or for the sponsor, Mr. Drake?
I do, but you haven't gone yet. Would you like to go first?
Yes, so it's still 21, this is just like regular tobacco, 21 to purchase?
Yep.
Okay.
Yes.
So when you talk about the increase, all right, so we know that the ability to purchase the cigarettes, okay? Mm-hmm. And how is the monitoring of cigarettes different than this?
So right now, it comes down to the fact that if you have a tobacco license in New York State, that list is sent to the different counties, and the counties are responsible for enforcing that license. So we send inspectors out to every licensed agency, and a lot of them do include products that are for vaping as well. We go and make sure.
For vaping?
They may have a tobacco license and they may sell tobacco and vape products. If they sell tobacco, they need a license. There are, however, stores that are just selling vape products that do not have tobacco licenses that we don't have jurisdiction over per se. So the licensed stores, we have to go and look that the license is displayed and that it's in date and that everybody's paid for it. The enforcement piece is a different story. We have to enforce that there are not sales to under 21s. We have 3 under 21 inspectors. So they can't be every place. And what they do is they go out and try to purchase cigarettes. And if they are sold cigarettes, we fine them. And if they have a number of violations, they lose their tobacco license. So that mechanism is currently in place through a TUPA, Adolescent Tobacco Use Prevention Act, in New York State. We don't have that protection for vape stores. So that is something that right now we have been talking, because we have in Albany County, Tobacco 21 does include e-cigarettes. We can do the same thing, but we haven't been doing it as regularly because we have the regulated stores that we are funded for, that we have to do every year.
Okay, so just one more question on what you just said. Do we know what the numbers are in regards to tobacco licenses versus vaping?
Yep. We do. And I have to give you an approximation because what I've heard recently is that we are getting a lot more applications. We're hearing from the state about more entities that are asking for tobacco license. Perhaps it's in anticipation of this potential legislation. So I believe at this state, and I will say these are approximate numbers, we have around 260 stores which have tobacco licenses in Albany County, and about 14 stores that are not licensed and that sell vape-only products.
Still vaping.
Well, they may sell things besides that, but I know that's what they're.
So it's 260 and 14?
Yep, approximately. I don't want to say exact
And
numbers.
that's just Albany County?
Yes, that's Albany County.
Any more questions, Wanda? Anything else, Wanda?
Yeah, I just let her go first on.
You did. All set, Wanda? Okay, go ahead, Mr. Tree.
Thank you for your presentation, and I agree with everything that you said. Is there any reason why we haven't funded the other stores, the 14 or whatever, for inspection for under 21? Was it just something we don't have funding for and we're waiting for? I was not clear on why we don't inspect them,
So
other than the time constraint.
So what our funding is for is to check state licensed facilities. What our local laws enable us to do is to go out to these stores because they do fall under the Albany County Tobacco 21 law. But as you can imagine, 260 stores, and we have a couple of inspectors. We do go out to them, and in the past, we have heard about certain stores that may be selling to underage kids and have sent inspectors out.
With respect to that, have you, and you can speak anecdotally because I know you wouldn't have data on something like this, but have you heard how kids are obtaining the product? Anything at all? I mean, can you share anything with us?
I've heard that they are going into stores and purchasing it. I've heard that kids are going into their stores in their school uniforms and purchasing it. I've heard that there are no barriers whatsoever towards going into shops. and
This is the
purchasing.
non-licensed stores, you think? Or any store?
Any store.
Any store, okay. Now, as far as the products that, certainly any tobacco product poses a health risk to minors, but the ones that they're going for, does that include pipe tobacco, cigars,
Well,
that kind of
it's
thing?
flavored vapes juice. It is flavored.
It's the flavor, but it's the vaping, right? The e-cigarettes?
Yes, yeah.
Okay. So, do you think that there would be a similar public health benefit if legislation like this targeted only the e-cigarettes like San Francisco did versus all flavored tobacco products of any kind?
So I think that there has been a ban on flavored tobacco products since 2009. I don't know if it applies to cigarettes or cigars, but I do think it applies to cigarettes. And the reason for that was because flavors were particularly attractive to kids. So in 2009, you know, the federal government decided that that was going to be banned because of the concern about an increase in youth smoking. I mean, if you look at the timeline since 1964 when the Surgeon General's report came out and said cigarettes are bad for us, we have seen these steady declines in smoking, and it's been great. It's a real public health success. We know there's a tremendous amount of disease, morbidity, and mortality from cigarette smoking. It's the #1 preventable cause of death. And now what's happening is we're seeing an uptick. And, you know, I think it's important in this legislation to really draw out the populations we're talking about. Because you're talking about people that have smoked tobacco and want to potentially quit. And then you're talking about people that may be adults and just want to try this stuff. And then you're talking about kids. You know, we do know nicotine is one of the most addictive drugs on the face of the earth. And we know also that the adolescent brain is particularly primed for addiction. Adolescent brains have a lot of plasticity. When you introduce a new substance to an adolescent brain, the dopamine system, which is the reward system, asks, give it to me again, and that just sets up addiction. So these kids that are thinking, and I think that a lot of them still think it's just flavored water, are now developing lifelong addictions.
So the vapor juice is really what's attracting the kids.
Yeah,
That's what it
I
comes down to
think,
it.
you know, and you know, as I said, for those that want to quit smoking, if you're used to smoking cigarettes, it's not intuitive that you would want juicy fruit to get off them, you know, flavored tobacco. The unflavored vaping would still be available to people that want to use it as a potential harm reduction. We know that there's less, it's likely that it's less harmful. But again, those studies are still ongoing. We're still waiting to see what they show.
This is not something you would have come prepared to discuss, but while we're talking about impact on youth and trends and changes, do we have any health data on the impact of marijuana use among youth? In other words, the health impact?
Oh, I could spend another 2 hours talking about marijuana.
To conclude, make it easy, would it be deleterious? Or is it positive?
Would what be deleterious?
The effect on youth, their health?
It would be deleterious.
Okay.
Yeah. And I do think that we're seeing upticks in that as well.
So what's interesting to me is what I consider to be kind of, can I use the word hypocrisy societally? Is that too harsh for anyone here? That the powers that be want to legalize marijuana without any regard to what that might do to the youth, but we're here taking away all flavored products, regardless of vaping. And I agree with everything you said on the dangers of vaping. Believe me, I'm not a vaping
Yeah.
proponent.
So-
I think it's interesting, and I just wanted your thoughts on that.
So any public health group or agency that you would speak to, and I'm the chair of the marijuana subcommittee for the New York State Association of County Health Officials, is against legalization.
Thank you.
So I do not think there is the support for that in the public health community. I think that we have seen that there has been too many deleterious effects from public safety, from ingestion, from youth use in other states where this has been legalized. And we do not think that there is the correct infrastructure in place for New York State to support going forward with this without risking adverse public health consequences.
So with what we can control, the vaping juice is what's attracting the kids, and that's what's hooking them on nicotine products.
Yes.
But not necessarily the mature adult type products. They're not going for those. They're going for the flavored juice. Thank you for your input today. I appreciate that.
Thanks, Mr. Drake. Wanda?
Okay. I almost forgot what I was thinking. But in regards to, again, the adults that have come and spoke against this. So it appears here that we have the adult who is trying to reduce their smoking versus the children that we are trying to keep from luring them into another form or a habit, okay? So I guess what I want is your opinion on, when you talk about the effects of this on young people, and all it does is like a gateway drug, as we would say, okay? Going right to, regular cigarettes or whatever else is out there too, okay? So weighing the people, the adults who have come in saying that this is the way that they have been able to quit smoking, are they really quitting smoking? Or are they subject to the same health issues as the kids?
Well, there's a couple different ways to answer that, but what I would like to start off with is just to give you a statistic from New York State that high school students use electronic nicotine delivery systems at rates 5 times higher than adults. So we're talking about, this is an isolated market. This is kids. This is kids using this. So that's the first thing, is that we need to know that it's more kids are using this stuff than adults. The kids won't come in and tell you, but they are using it. They're all using it. When I told my kids I was coming here to testify, they said, oh, I don't want our friends to know about that. Everyone uses these things. The second thing is, in terms of health effects. So, as I said, in terms of adults that are smoking that want to stop, there has been some evidence to show that this is better than placebo. So it's better than nothing, and some studies show it may be around the same range as other FDA-approved measures of smoking cessation. So when we talk about what's FDA approved for smoking cessation, we have 5 products. We have nicotine replacement therapy, which is in gum and in patches. We have Wellbutrin or bupropion and varenicline, which is Chantix. These are medications. Early studies, and again, we don't have enough to say definitively it does or doesn't work. Early studies show it may be on par with some of those medications. But the concern is that those other FDA-approved things have off-ramps. So you don't take those medications for the rest of your life. And what we see in the studies so far is that a very high percentage of people that use e-cigarettes to get off traditional tobacco are still smoking e-cigarettes a year down the line. So there's no real off-ramp. And as a physician who's been in primary care practice, when you're helping somebody quit, you want to tell them what the off-ramp is, and that's just not established. We don't know.
Is that Wanda?
I was just going to ask on that point, to clarify this, because the nicotine is the addictive piece, right?
That's
So
right. Yep.
it's still an addictive substance, right?
Yes, it's
That's-
highly
that's the
addictive.
problem. We just don't know what
Yeah, I mean.
the long-term
this is-
effects on the adults would be.
The thing is, nicotine is highly addictive. On average, 1 in 10 people that tries to quit smoking is successful. It's notoriously hard to quit. It is so hard to quit. It is the hard, and if anybody here knows people that have smoked their whole lives, they'll tell you, it's hard, it's as hard as heroin to quit. So we don't want kids started on this path. And that is the real concern. If there is a place for this, which there may be, for harm reduction in adults that are currently smoking, they can do that without the flavor, without the, the juicy fruit and the flavor, all that kind of stuff. That's not necessarily part of it. And we really do have to keep our eye out and see what the long-term studies show. Lots of studies are underway. We just simply don't have information, and because it's not FDA approved, we can't say, yes, it works to help people stop smoking, or yes, it's terribly harmful, or no, it's not harmful at all. What I would say from the literature that I've reviewed is it's not harmless. There's a potential that it may work for harm reduction for adults that are current smokers, and there's a huge epidemic of youth use that is may likely cause us to backtrack all the work we've done in the past 20, 30 years to stem smoking rates.
In your opinion,
And that can be quantified in terms of, health expenditure. It's incredibly burdensome on a nation's health structure.
in your opinion, would greater law enforcement ability to penalize people who provide these products, would that have any effect?
Not necessarily.
Because you're saying they can still buy them somewhere.
They can.
Thank you, Mr. Drake. This came out of Law Committee without recommendation for many of the reasons you raised tonight, Mr. Drake. However, we are responsible for public health, and I do appreciate all your work on this, Dr. Whalen. So because of that, I'd like to ask for a positive recommendation to move this out tonight of health.
Second,
I need a motion first.
I make motion that we move this out with a positive recommendation.
Motion by Wanda. Can I get a second?
Sure.
Second by Lynn. All in favor?
All right.
Any opposed?
I'm opposed to the positive recommendation, if I may qualify my opposition.
Okay, so one opposed, Mr. Drake. Dr. Whalen, thank you so much.
Thank you.
Can I get a motion to adjourn?
Motion.
All in favor?